Here at Ravenswood Chiropractic, we see a lot of pregnant women, and they do come to us for back pain. So during pregnancy, the patient's body releases a lot of hormones, and the hormones that we release is called relaxin, and it helps soften the ligaments of the body to help prepare the woman's body for delivery. With a lot of the postural changes that happen in the softening of the ligaments, the growing abdomen, the weight gain that happens during pregnancy, as well the baby's position, can all contribute to the stresses that are placed upon a woman's body. When you treat a pregnant woman with chiropractic, you're essentially treating them the same. There's just certain things that we just don't do. We don't do electric stim, we don't do ultrasound. There's a lot of modalities that we just won't do during that. So we have to work around those. The treatments are typically the same. We just have more care and special tables that can allow us to get the woman to lay on her belly, to work on her back properly, to stretch the right muscles, and to apply the right adjustments in order to help relieve the pain. When we treat a pregnant woman with back pain, it depends on what stage of pregnancy they're at. Typically up to the weeks of 18 to 22 weeks, we can work on core strength. And having good core strength going into a delivery is essential. It will help you recover faster. Now, when you get over 20 weeks, we typically focus more on the glutes, in the thigh muscles, because that's going to help you in labor and delivery. Because there's as I say, it's a marathon that you have to run, and having the great strength that you have in your pelvic floor and your glutes and hamstrings are going to help you labor better and have a more successful and less intervention delivery. So when should a woman get chiropractic care during her pregnancy? I would say as soon as they find out they're pregnant, they should be having that appointment that they get evaluated. Typically at that point, if there's no concern for other issues and there's no pain, then we would do just kind of monthly adjustments and check in with her and make sure that everything is going fine. And if there's little things that happen during that time, that we were able to mitigate those by maybe doing some extra stretches and that, and making sure she's on the right physical routine for exercise and those things. Now, once the woman gets up to about 32 weeks, we recommend going bi-weekly. And then at 32 weeks, we recommend going weekly until delivery. And that's just so we can make sure that the pelvis is moving properly, well aligned, so that it helps with an easy labor and delivery. Now, if a woman is in pain, they should come in right away. We say longer than a week is not normal, not good. You should get checked out right away. Because if we can get after something sooner than later, then typically with a pregnant woman, it can get worse quite quickly. We just recommend getting that checked out. Another reason why women come to us for pain is that they sometimes get abdominal pain, and they're worried that something's going on internally. And they go to their doctor and they see that there's nothing happening there, but they're still concerned. A lot of time we get muscle spasms in the abdominal wall, and we can discern that by having the patient raise their legs and looking at whether this is an abdominal wall trigger point or if it's just something that's just more concerning. So having that evaluated and making sure you handle those really helps a pregnant woman during pregnancy. I do get a lot of patients who come to me in the last couple weeks of pregnancy and they want an adjustment, and there's no harm to doing it. We do recommend that you kind of do a regular routine through it, but at any time that you feel like you need an adjustment or want an adjustment, or your doula or midwife or doctor is recommending that you get one in order to help with great pelvic alignment, then that's what I would recommend. Most doctors can treat a pregnant woman because we have the right tables and techniques to do so. Certain doctors have advanced certifications, like Webster technique, like I have, that goes into very in-depth about the whole pregnancy process and techniques that you use in order to assess a woman and then apply the appropriate treatments that they need in order to help with their pregnancy. If you're pregnant and you want to get an adjustment, then please feel free to call us. We're happy to help you. And if you just want to talk about whether it can help you or not, or you're a little fearful of getting an adjustment during your pregnancy, we're able to sit with you and talk to you about it. I'm Dr. Renn. Have a fantastic day.